Hello, I hope everyone's having a good afternoon. Sometimes the difference between vision and blindness may lie in a single overlooked electrolyte. So, I'm Dr. Sakshi Bhamaj, an MBBS intern at Dheeraj Hospital, Sumandeep University, Vadodara. And today I'm presenting our study on serum magnesium in diabetic retinopathy and its association. So, diabetes mellitus is a chronic metabolic disorder characterized by persistent hyperglycemia. So over time, this metabolic dysregulation, it leads to microvascular complications like nephropathy, neuropathy, and diabetic retinopathy. So diabetic retinopathy remains one of the leading causes of preventable blindness worldwide. Now, while hyperglycemia is the primary driver, growing evidence suggests that micronutrient imbalance, particularly magnesium deficiency, may play an important role. Magnesium is a key intracellular cation involved in insulin secretion, insulin receptor activity, glucose transport, and endothelial stability. Hypomagnesemia is frequently observed in patients with type 2 diabetes. It is known to worsen insulin resistance and glycemic control. However, its association with the presence and severity of diabetic retinopathy, especially in Indian cohorts and populations with normal renal function, remains underexplored. The objective of our study was to determine the association between serum magnesium levels and diabetic retinopathy in patients with type 2 diabetes mellitus and to correlate magnesium levels with severity of retinopathy. Uh, Magnesium is a key intracellular cation. I think I told it in the introduction part itself. We conducted a cross-sectional observational study on 100 patients with type 2 diabetes mellitus at a semi-urban tertiary care teaching hospital. The patients were divided in two groups, diabetics with retinopathy and without retinopathy. Retinopathy, we further categorized it into not non-sight threatening and sight threatening. We assessed the clinical profile, glycemic parameters, serum magnesium levels, and we did eliminate the confounding factors, renal dysfunction, hypertension, GI disorders, alcoholism, and those on diuretics or aminoglycosides. This ensured that the magnesium variation, it was not influenced by any other secondary causes. Our findings showed that patients with diabetic retinopathy had significantly lower serum magnesium levels compared to diabetics without retinopathy. Secondly, more importantly, we observed a progressive decline in magnesium levels with increasing severity of retinopathy. Patients without retinopathy had the highest magnesium levels, and those with non-sight threatening retinopathy had lower levels. And patients with sight threatening diabetic retinopathy had the lowest of the magnesium levels. This suggests a severity driven association. Additionally, lower magnesium levels were associated with poorer glycemic control and HbA1c levels. Magnesium deficiency may contribute to impaired insulin signaling, increased oxidative stress, endothelial dysfunction, and microvascular damage. These mechanisms are central to pathogenesis of diabetic retinopathy. Our findings support the hypothesis that hypomagnesemia may not be merely a marker but potentially a contributing factor in microvascular complications. To conclude, serum magnesium levels are significantly lower in patients with diabetic retinopathy. There is a clear inverse relationship between magnesium levels and severity of the disease, with the lowest levels of observed sight-threatening diabetic retinopathy. So, magnesium may therefore represent a simple modifiable risk factor in the prevention or progression of a diabetic retinal damage. So, in the management of diabetes, we focus intensely on glucose, but perhaps it's time we pay attention to the magnesium levels and routine assessment of serum magnesium levels may help us with this. Thank you. I'll take in questions.
Thank you.